All right,
Yeah.
go ahead. Go ahead.
Awesome. So thank you so much to everyone who's joining us today. My name is Dr. Shazine Ratansi, and
Yeah.
this is my co-resident,
Yeah. Hey guys, I'm Dr. Joel O'Neill.
and we're both Pros residents at the Dental College of Georgia.
Mhm.
Thank you both for joining us today. My name is Dr. Saqib, and I'm one of the board members at Dicey Dentist, and we're pleased to have both of them presenting about prosthodontics residency.
So like I said, my name is Shazine Ratansi. I'm originally from Atlanta, Georgia, and I went to Williams College in Williamstown, Massachusetts for undergrad. And it was way too cold there, so I decided to come back to Georgia and I attended Dental College of Georgia for dental school. And then right now I'm a second year pros resident at the Dental College of Georgia. I have two cats, Teddy and Poppy, and I like to read, knit, and annoy my co-resident Joel in my free time.
And like I said, my name is Joel O'Neill. I'm from Chapel Hill, North Carolina. I attended the UNC Chapel Hill for undergrad, where I got a BS in biology. I graduated this past May from the East Carolina University School of Dental Medicine, and then I decided to leave North Carolina finally and come to Georgia. So I'm a first year resident here at the Dental College of Georgia, in the PROS program. And for my interests, I like to run. I'm actually training for the Chicago Marathon this upcoming October, so it's gonna be fun balancing that with residency. And then I like traveling. That's a picture of me in Japan. Like I went right after graduation. And those are some of my pets. The top dog, that's Max right there. He's 14. That's Bella. She's a Bernie Doodle. And I also have a leopard gecko named Kiyoshi. Mm.
And these are some of our co-residents. We're really lucky here at DCG because we have a very diverse group of residents. So not only do we have residents from all across the US, but we also have some international residents as well. And that's a really big plus in any residency program because you get to learn a lot of different perspectives and a lot of different methods of treatment. And you can kind of see the differences in everyone's philosophies. And it's very interesting when it comes to treatment planning complex cases to get some of that insight from people who may have learned to do things that are different from you. So yeah, it's really cool. We have a very diverse group.
So what is prosthodontics? Prosthodontics is one of the 12 dental specialties recognized by the ADA. The ADA definition of prosthodontics is the dental specialty pertaining to the diagnosis, treatment planning, rehabilitation, and maintenance of the oral function, comfort, appearance, and health of patients with clinical conditions associated with missing or deficient teeth or oral and maxillofacial tissues using biocompatible substitutes. The American College of Prosthodontics defines a prosthodontist as a dentist who specializes in aesthetic restoration and replacement of teeth, receives an additional of 3 to 4 years of training after dental school, and restores optimal appearance and function to your smile.
And I think for both of us personally, we really believe that PROS emphasizes a knowledge of every branch of dentistry in order to comprehensively treatment plan and care for your patient.
Mhm.
So I decided to pursue a prosthodontics residency because I actually shadowed a prosthodontist while I was in college. And that was a very cool experience for me because it's the first time that I saw someone doing a full mouth rehabilitation or doing a full arch fixed complete case. It's the first time I saw any of those things. And it was just so cool to me how he had integrated digital dentistry into his practice. And this was very early on. He had like one of the first scanners that I'd ever seen. And I just thought that was so cool that he was so like cutting edge. And it was just very different from any general dentist practice that I had shadowed in before. And then I also decided to work in a dental lab for 1 year before dental school. And that really triggered my interest in pros because I was able to see what it's like to actually, use dental materials and actually make the prosthetics. And in a pros residency, you do have to do a lot of your own lab work. So that was pretty helpful. And then during dental school, I decided I wanted to pursue pros because I really wanted a lot more knowledge on how to comprehensively care for my patients. So for a lot of patients, PROS is actually considered to be the end of the line patients come to see us because no other dentist is able to help them. And I really wanted to be able to help those people. I had a lot of patients in dental school that I had to refer out to pros because I was not able to handle their complex care. And I decided that that was something that I wanted to be able to do. So that's why I decided to do this residency.
Yeah, for me, so I actually came into dental school not even know what a prosthodontist was. I knew going to dental school that, I really like digital dentistry and, you see on social media and through your research of dentistry, like you see these really big cases, that you see, dental professionals, conducting with their patients. But, I didn't know specifically that there was going to dental school that there was a specialty called prosthodontics where you can do that like exclusively. Um, I came into dental school knowing I wanted to specialize, so I went through my endo phase, oral surgery phase, a peds phase for a little bit. But really, that was all in pre-clinic, and definitely my advice, like if you're not in clinic yet and you're like open to specializing, but you're not sure, but really what helped me was going to clinic and my like actually doing the treatments myself. Seeing is one thing, but actually doing it is another thing. Like I thought I liked endo, then I realized I hate root canals. That's just personal, but I have friends who are going to endo residency and they love root canals. Everyone's wired differently. But for me, I remember like my first comprehensive exam was actually this patient who needed veneers, and it was really cool. My faculty let me take on the case. I got to work with our cosmetic dentistry faculty, our pros faculty, our perio faculty. And it was really cool to just see interdisciplinary care being done with all the different specialties and seeing kind of the prosthodontist kind of being the linchpin in that, kind of the quarterback, kind of seeing them kind of make the shots and come up with a definitive treatment plan was really cool to see. And I realized I wanted to kind of take on that role, hopefully after dental school. And like in general, another thing I really love about pros is you get to handle these really complex cases, and you can really change the quality of life for the patients that we see, and especially, you have patients from all walks of life. They're coming to you. Sometimes it's obviously the very common things you see in dentistry, caries, perio, but you'll have patients, and we'll show you later on, patients who are, maxillofacial patients. Maybe they had cancer or whatever it is, and they're just coming to get a second chance, and you're able to give them that opportunity with the training again, prosthodontic residency.
So why should you choose a prosthodontics residency? You should choose pros if you're interested in treating more medically and dentally complex patients. If you want to treat maxillofacial patients who have maybe had a history of, some sort of oral cancer and have a defect that needs to be restored. If you want to become more skilled at placing and restoring implants. If you want to work with and coordinate with other specialists, we do this on a daily basis as a prosthodontist. So we're really the quarterbacks and we coordinate all of the care for our patients. We're sending referrals all the time. We also treat patients more holistically. Process is also interesting because you can truly understand why you do the procedures that you're doing. So we do a lot of lit review, we read a lot of literature, and that's just so that we can understand the reasoning behind why we do impressions a certain way or what our philosophies are. You have multiple options after residency if you become a prosthodontist. So a lot of prosthodontists go into private practice. Prosthodontists are very sought after in academia, especially board certified prosthodontists. And you can even go into corporate dentistry. So there are DSOs like ClearChoice and Nuvia that are looking for prosthodontists every day. And residency in general allows you to conduct more advanced procedures on your patients with the support of an experienced clinician. So it's also a big plus that you're not just thrown into private practice or having to do CE to learn all of these procedures. You can actually do them with the help of someone who is more experienced, a more experienced faculty one-on-one. And that's very interesting to me. So yeah, that's why you should choose a pros residency.
So how's pros residency going so far? We like to have fun still. I know it's true. The pros stereotype is, we're stuck in lab all day. And even though we are stuck in lab all day, we do our best not to burn out. We try our best to have fun. Like in the top left, and we'll kind of go into the next slide too. We do a lot of conference travel. The top left picture and the middle picture, that was us in San Diego this past fall, we were in San Diego for the American College of Prosthodontics annual session meeting. And it was just a really great opportunity. You get to network, you get to have these companies take you out for, this was a Brazilian steakhouse we went to, and we had a really great time. And, we even do fun things like we did a Barbie, for the Barbie movie, we did a pregame in my apartment. So that's all of us dressed up in pink in the bottom left. And thankfully, like our school, and this is a great thing about residency is you get to go to all these conferences and get to do these a lot of experiences with the school ideally funding you. On the bottom left, that was me and my co-residents Marcia and Anna. We got to go to Buffalo, New York, and we that's where the Buffalo, New York is, like, yeah, it's the Ivoclar North America headquarters, and that's also us at Niagara Falls with the UNC Prosthodontic residents, and we all got to just go together, and we got to get training on how to set denture teeth, how to set an ideal denture, and then also to learn how to process Emax crowns. And it was a really good opportunity to just learn from the people who provide us the dental materials. And, we also get, they took us out and gave us a good time as well. And we also do our little what I guess was a white elephant.
Oh yeah, that was the white elephant.
Yeah, a little white elephant. We got to exchange gifts, and then not on the bottom right, that was our trip to Chicago for the fixed pros meeting, and we also went to the Balloon Museum during that trip in Atlanta. So yeah, and yeah. Oh, and do you want to do this?
Oh, it's
Yeah.
just a big plus because sometimes you even get to present at some of these meetings.
Mhm.
So in the bottom left, one of our chief residents, Dr. Baker, actually got to present her research at the Academy of Osseointegration meeting that was in Charlotte, North Carolina. And we also get to do some cool joint lectures with the Fort Gordon residents. They're the Army residents that are just basically down the hall from us. They are also in Augusta.
Mhm.
So we get to do some cool lectures with them. And we also have an implant week where we get speakers from all across the world who lecture us. And that was Dr. Posey in the top left. We took a picture with him. He came all the way from Italy to lecture us on fully guided surgery techniques. So that was pretty cool. And then you do a lot of lab work as a pros resident.
How many dentures was that?
We processed 8 dentures in one night.
Yeah, it was fun.
And I just processed a denture right now, like
Yeah.
right before I got on this call. So sometimes you're here really late doing
Yeah.
lab work, but it's a lot of fun. At least you get to do it, hopefully you have a co-resident with you and you're not like stuck in the lab alone. So,
Yeah. And on the top right, that's Amanda Bear, our anaplastologist. So
um,
that's a really cool thing. At the Dental College of Georgia, we have an anaplastologist. If you don't know who they are, it's a healthcare profession where they actually make extraoral prosthetics. They make ears, eyes, they even make hands and fingers. Basically, whatever prosthetic you need, they're the ones who make them. And it was really cool because this she sees her patients in the prosthodontic clinic as well, like once a week. And she also does seminars with us. So this one, we actually got to try our hand at painting irises for ocular prosthetics. So it was really cool to kind of see how artistic you have to be to be able to do something like that. And that bottom picture, that's just me with our chief resident, Dr. Baker, after one of her implant surgeries. So it's just like kind of just giving a holistic view of kind of how process residency is going. So yeah.
So how and when do you apply to PROS residency? So the ADEA Postdoctoral Support Service, or PASS, opens on May 8th, 2024. And it costs $199 for the first program that you apply to and $92 for each additional program. So it's always good to have a little bit of money saved up before you apply to residency. All programs will accept PASS. It's kind of like the Common App for college, but it's for graduate students. But not all programs will participate in Match. So you need to check each program that you're interested in. We did provide a link. If you Google I believe it's the ACP has a graduate search function where you can look up any program in the US. You can look it up based on state, and it tells you whether or not the program participates in Match, and also gives you some information on how to contact the program or the program director, an email or something like that. So I would check and see if your program is going to participate in Match. You have to register for Match separately from PASS, and some non-Match programs will either not allow you to participate in Match, or they will ask you to drop out of the Match if you agree to accept a position at their school. So it could be that you never get to interview even at some of the other schools that you've applied to, because you will have to drop out of match and drop out of the process if you accept a non-match residency position. So that's just something to keep in mind. Personally, when I applied to residency, DCG was a match program, and I only applied to match schools just to make things a little bit easier for me. But DCG recently became non-match. So that's just something to keep in mind. You want to get your letters of recommendation lined up in your D3 year. You need a minimum of 3 and a maximum of 5 letters. And I just asked 2 pros faculty at the school that I was close to, and also the faculty that I did research with. And you want to prepare a CV and a personal statement to upload to the PASS application. You can do this ahead of time so that once PASS opens, you can just upload everything and you're good to go. You also need a dean's letter, transcripts, your INDBE scores, and make sure you've made a list of programs that you're interested in based on location, tuition, and your goals for residency. And Joel will go into this a little bit more. We do recommend applying to at least 10 programs if getting into a program is your main goal. For me personally, I applied to a lot less because for me, the goal was to get into a program that had an associated stipend, because I had already decided that I was not going to attend a pros residency unless I could get paid to attend a pros residency, because everyone's already in a lot of debt.
Yes.
So for me, I only applied to programs that either had an associated stipend or did not have a very high cost, low tuition. And in the end, I only ranked 4 programs because for me, I thought, if I don't get into residency, I can always go work in private practice or get some more experience or do, an AGD or something, and then I can apply later on. So that was what was important for me.
And a lot of this information is pretty general to the whole match process, but so basically after you apply, you interview, and we'll kind of go into the next slide about what you should be looking for when you're looking at different residency programs. But then match day happens. Match day is usually the last day, like last week of November, first week of December, around that time. And so that day you usually get a email, and you ideally I say ideally get it'll tell you what program you match at. The reason I say ideally is I actually didn't match on match day. So I applied to 6 programs. That's why we're talking about sometimes it's good to cast a wider net, apply to like 10, 13 programs, and then but obviously there's a lot of things to consider there. Sometimes better do less. And so I actually didn't match on match day, and of course it was tough to see that and get that news and have to kind of figure out what was next. And so what happened next, which is I think is really important because you want to be prepared for the eventuality, is there's a post-match process. So on the day of match day, in the morning, you hear if you match or not and what program it is. If you don't match, like me, you at 12 o'clock, it was 12 o'clock, on the national matching service, they have basically a list of all the pros programs. They even have the other specialties too. If you feel like switching last minute, I don't think that'll work out well, but especially if your whole application is geared towards pros. But like for me, my cycle, there were 6 programs. DCG was one of them that had like an open spot in the program. So then you apply to all those programs just through pass, and then honestly the programs were like immediately reaching out to see for offering interviews. So that's how I interviewed at DCG, and then I was able to get accepted. So don't take it as if you don't match, it's the end of the world. There are other options post match, and then other great options too is if I didn't get through post match, I already had a spot at my dental school's AGD as a resident, and I was going to reapply. Doing an AGD or GPR will definitely strengthen your application, and private practice. All of those 3 are really great options to help grow your application if you think that will make it stronger for the next round. So things to consider while applying / interviewing, and I think you'll get the best vibe check but when you go to the programs. But when you're doing your initial research, of course, you're investing a lot of money into your application, so you want to plan accordingly. So Shaz already mentioned, the big thing that you gotta be aware about, which is an unfortunate thing with dentistry, is especially dental specializing within dentistry, a lot of specialty programs you have to pay a stipend. So I mean, you got to pay tuition, and it can get very expensive. It can even get to like 100K a year, just like it is for some dental schools. So that's definitely a factor you have to take in. Some people are able to afford that and are okay with that, or there's something about a program that they really like about it that they're okay with paying that tuition. But like we were saying, that was one of the great selling points for me coming to DCG was that we don't have tuition. We have a stipend that we get to that we get every month. So, and I think that's really helpful, and prevents us from getting into this deeper hole of debt. But like you were saying, at UAB, you can
Yeah,
also.
so UAB actually gave you a position at the school as a faculty essentially in your second year of residency. This is what they told me during my interview. And then they would pay you for that position, and you would also get benefits for that position. So although I think their program was 60K for all 3 years, which is not bad at all. They did have an associated tuition, and this could have changed since then because this was 2 years ago. But although they had a tuition, they were also going to pay you to be a faculty there. So that's something to keep in mind is some schools will attempt to offset their tuition by giving you some other like stipend or,
Yeah.
pay.
And also, I mean, kind of a general range. Like if you apply to like an Ivy League cross residency, it's usually around like 100. I think what UPenn's like 150K a year tuition. And then also, just like dental school, in-state residency programs will have more affordable. They'll have in-state tuition essentially. So I'm from North Carolina. And that's why that's another reason why I really wanted to apply to. That's why I applied to UNC's PROS program, because they offer an in-state tuition that's cheaper than their out-of-state. So that's just something to consider. Another thing is, what kinds of procedures do residents do? So this question is very broad. I mean, the first thing is, do you want to go to a program that's really surgical? The CODA accreditation process, now you need to have competency in placing implants, but the implant placement, the amount of implants you place varies throughout the programs. So famously, Yukon Prosthodontics, they're known for they're like the surgical prosthodontics mecca. It's like they place implants, they're doing all on fours. They just if they can place an implant, they're placing an implant. That's what they're known for. And but then you have other programs where they may do the bare minimum. I think our programs we usually I think on average we place like maybe like 10 to 15 implants during your time in residency. But in contrast, we spend more time on the restorative side of things. So so some programs are more restorative based, some are going to be more surgical based, some are going to be more in between. Okay. And this can always change with uh, you know, program directors and different things. So a program may not be as surgical, and then they change directors, and then things change with that. So but that's why it's very important to talk to residents to see what type of procedures they're doing. Another big thing is a program, especially with digital dentistry is the new frontier, and it's where everything's going. And prosthodontics is the driving force with that, with the research we're doing into, standardizing these digital workflows. So, but some programs, they are, still strictly analog, and then some programs, I think like UAB is
UAB is very
yeah,
digital.
they're
Yeah.
very digital.
They even do digital articulation.
Yeah,
So
so our school recently opened up a digital lab, and our program is right now. I feel like I came into the program at the right time. We're initiating more digital workflows into the program, which is really good because I really want to learn those things in a full mouth rehab scenario. So I mean that's why I'm happy our program's not only solely doing analog, and they're really open to us into implementing digital workflows in our treatment. So that's another thing to consider. Another thing too is our residents are required to assist each other. Unfortunately, just like in dental school, like at my dental school at least, we had assistants, but it wasn't a lot. Unfortunately, with some programs, you can go to a residency program, ask them, do you guys have assistants? Some of them will have no assistants, or they may have one for a group of like 13 residents. Our program, which is amazing, we have, I don't know how many
it's
assistants.
almost like 1-to-1
It's
assistant
almost
to
a 1-to-1 ratio.
residents.
Sometimes it's a 1-to-2. So especially when you have a patient in the chair all day, you're doing these more complex treatment plans. It is awesome to have an assistant. And these assistants, like a lot of ours have been in the pros clinic here for a long time. So that just really helps. They just know what you need. and they're able to help you. And also on your end, you're here in residency to be a provider, not be an assistant. So I've talked to people from other programs. They, have to like assist in the morning and then be a provider in the afternoon. And I know, I feel like you're already taking 3 years out of your time, out of your career to be in residency. You want to optimize as much time with clinic as you can. And the next thing is programs will vary with the teaching requirements. So, some programs, during your first year, you may actually have to go and, cover operative clinic. And our program, I think is not as intense as that. Usually it's our third year that our chief residents, they have to go up to the sim lab and they cover the fixed and removable courses. So there's another question to ask. Another thing too is how much of the education is clinical versus didactic. Some programs, more of their week is spent time in clinic, and some of it's more spent in time in lecture. I think our program is more clinically focused. We have lectures from 8 to 9, and then we're seeing patients from 9 to 5. Monday, Tuesday, Thursday, Friday, and then Wednesdays, at least for the first and second years, we're in clinic and we're in lecture and doing literature review. And is there a research requirement? That can vary with each program too, in the sense of how intense it is. I think most programs have a research requirement. Our program does as well, but it's not as intense as other programs, as you
Yeah.
would say. And the next thing too is, with each dental specialty, there is a process to get board certified. Unfortunately for pros, it's a very extensive process. There's a written
Yeah.
board, and then you actually have to present a fixed prosthodontic case and a removable prosthodontic case in front of a panel, and then you get asked a bunch of questions. It's very stressful. There is talks about it switching to written boards. But there's no timeline or anything like that. Uh, but with each program that varies. Some programs really incentivize you or require you to get board certified or start the process. Some programs will ask you to at least pass the removable case presentation section of the board exam. I don't think any of them require you to do the fixed pros. I've only heard the removable, I think.
No,
But
or I've only heard removable or one part and written.
yeah, our program, they ask us to do the written boards only, in the sense of as a requirement for the to graduate the program. That being said, that's another thing that we don't have here is if like one great thing about our program, we have Dr. Thompson. He's Dr. Jeffrey Thompson. He's a board examiner, and he's also going to be like the president of the board examiners, I think, this upcoming year.
Yeah.
He's awesome. We love him, and it's really good to have a board examiner at your program, especially if you're trying to get board certified, because they know what the ideal cases look like and how to do these presentations, and they really guide us with that process. So it's really good because having him, he joined our program a year ago. It's been like a godsend and really motivates us to want to get board certified ourselves. And then I think honestly, the most important things are the last two questions. Is very big thing is like, what is the residency culture like, and are the residents happy? And this is something you can see things online, but honestly, when you go for the interviews, you're gonna see that when you'll go to I interviewed at programs where the residents were definitely not enjoying their experience. You can definitely feel a cutthroat atmosphere in the program, and you're with these people more than you're with your own families. You're in the lab with them, processing dentures, doing lab work. You're there in the clinic. You're with them in lectures. So you want to make sure you like the people that you're around. And I think that's a big thing for me personally. I mean, some people may not care as much, but I did when I was interviewing at programs. I remember when I came to DCG for my interview, all the residents and faculty were all laughing, making jokes, and it was a good time. But they all also prioritize good patient care. So I think that's definitely important. And are the facilities nice? I'm thankful because DCG, we have a really great the DCG Dental College of Georgia has been around for decades, but this building opened up in 2008, I think.
Yeah, I think it was like 2008,
And
2009.
so
Pretty new.
yeah, so we have a whole wing for pros. We have a nice big lab just for pros, and we have our own clinic. That can vary program to program. I interviewed other programs where they had a whole resident clinic where all the different dental specialties were all in the same clinic, and I just didn't. They're like, or like their dental lab is super small, and maybe the facility's just not as nice. So those are just things to keep note of while you're during your interview cycle. So.
So what factors do we consider in our pros residency applicants? So I would say, GPA is pretty important. It's important for any residency. They're definitely going to look at that. Research and leadership experience is a big plus. Research experience because you're going to have to do research in your residency most likely. So it's good to see that you have some interest in that and some experience with that. And leadership experience is good because we're always, as we mentioned, some of the pros residents have to teach. You have to teach the dental students. They might be coming into your resident room and asking you for help. And you also have to give a lot of presentations. And so it's very important to have that experience. Work and practice experience is a big plus. A lot of people do private practice or they have private practice experience before pros residency. It's not a requirement at all. We take a lot of applicants that are right out of dental school, but if you have that experience, then you should definitely mention it on your application. Externships and shadowing are always a good idea. When we have people who extern or shadow at our program, it's really nice because we're already familiar with them. So when they come for the interview, we already have kind of built up a bond with that person. And we just, feel a lot closer to them and we can get a good idea of whether or not they vibe with us. And it also gives you a better idea of what exactly people are doing in the residency. What does the day-to-day look like for the pros residents? What kinds of cases are they doing? You can see all of that when you extern or shadow. Those are things that you might not necessarily see during the interview process. Most residencies will require a presentation or a hand skills test as part of the interview. So I think almost every pros residency that I applied to required me to give some sort of presentation. Either it was a free-for-all topic or they gave you a topic. So for example, DCG had a pretty easy one. It was like introduce yourself, your hobbies, why you want to do pros. I think Harvard had an open-ended topic and I ended up presenting one of the cases that I did in dental school. So you are going to have to give some sort of presentation and have something ready. They will let you know about that ahead of time. And then the hand skills test can vary. Here at DCG, we have to do what, 3 crown preps?
Yeah.
On a mannequin. And then some other residencies require making a provisional. One of the interviews required me to carve a tooth from a block of wax. So that was pretty whack. But so just keep that in mind that the interview may not necessarily be just an interview. You have to give a presentation or do some sort of hand skills test. And then we're looking for people who are good team players. We help each other out a lot in pros residency. We learn a lot from each other. So we want to make sure that you get along well with everyone, have a good personality, and that we can get along well with you basically. So yeah, that's what we're looking for in a pros residency applicant.
And one thing I did, which is definitely not a requirement at all, is doing the portfolio.
Oh
Yeah.
yeah. So you don't have to do this, not a requirement at all, but Joel did have a case and some pictures that he showed us during his interview. Like I said, not a requirement. If you have something that you want to show, you can definitely bring it. But just be careful too when you show things because
You are a dental student.
yeah, sometimes then it can open up a lot of
Making a fun-
questions or yeah
So that-
about
I remember I showed that case to the residents. They're like, Joel, this is really cool you did this, but do not show this as one specific faculty you're interviewing with
yeah.
because they're going to ask you a billion questions and tear you to shreds. And I was like, okay, thanks for giving me the heads up.
Yeah, but
'Cause,
it was nice that he showed it to us.
yeah.
And like I said, I did present one of my cases, but one of the things that I emphasized was like, I know absolutely nothing. And there are a lot of things I would change about this case if I did it again. So, and it's also, if you do have a lot of experience, I wouldn't necessarily brag about it during the interview either.
Yeah, that can come
because,
off bad poorly too.
yeah,
Because we've
so
seen
just
that.
be humble. That's
Yeah.
important. And make sure you treat everyone very well during your interviews. So we occasionally have the assistants interview applicants. You'll be meeting our front desk staff, and it's very unfortunate, but sometimes people treat front desk staff and assistants differently than they treat residents or program directors, and that's not okay. And that's something that almost always makes its way back to us too. So just keep that in mind. Just be very polite to everyone as soon as you enter the building.
Yep. So yeah, these are some of our, we wanted to just go over some cases, kind of show you kind of the stuff that we're doing, the treatments that we're doing in our pros residency. So this is what, I think this was my first completed case in residency. So this was a 71-year-old male. He presented to me, I mean, with a resection of his lower right mandible. So he had this mandibulectomy last year, and it was because he had a squamous cell carcinoma that was present on his lower right mandible, and one of our oral surgery faculty did the resection. So the oral surgery faculty, they put a hiatus on any sort of implant surgery for the next 4 years, just to make sure there's no reoccurrence of the carcinoma on his on in the lower right. So as a result of that, he was referred to us for restorative treatment, but they requested that we only do removable prosthetic. So that was something we had to explain to the patient. He was totally understanding, and thankfully on his end, his oral hygiene was good. There was no other or in a periodontal status. So there was no other treatments that we had to do for him. Like everything else was healthy. It was just giving him that basically essentially what we did was a partial denture. You can go on the next page. And so these are his extraoral pictures. And on the next slide, you'll see our intraoral photographs. So you can kind of see, so this is one thing in pros residency, you're gonna get really good at taking photos. I think residency in general, but in pros, during our comprehensive exams, we have to take a series of photographs. So these are, these are the picture, the intraoral photographs, we took. So the one on the left is our frontal shot, then our buccal and occlusal shots. And you can see where the resection was on the lower right mandible. The oral surgeon did a really great job. They made sure to, while doing the resection, they kept the remaining teeth safe. And it was really clean. But the big challenge with this case was on the lower right, when they had to do the resection, the patient doesn't really have any more keratinized mucosa anymore. So it's all movable tissue in that lower right. So trying to put a prosthetic that sits on that, it was going to be a challenge. And that was something, and this is something with pros in general, and even you as a just you, even if you don't go into pros, is managing expectations with treatment. My patient came in, he was expecting he's gonna get a partial denture where he's gonna be able to talk in it, wear it all day, be able to chew, eat all types of food on his lower right again. And I had to tell him, with the amount of bone he lost there and with all that movable tissue, that we'll love to, we want you to try out and see what you can do with the partial denture, but there's a high chance it's just going to be for aesthetics. And thankfully he was a really agreeable patient, and we did a whole design. We had to pull up those survey casts, and we went ahead and I was able to make a design. We did all the rest preps, and we made a partial denture for him, which you can see in the next slide. Yeah, so I took some pictures of the case before we delivered it, and it was overall, like, it's the same, as you guys run dental school, you go through the whole process of looking for all undercuts, making and just making your RP design. The interesting about this case though was just how thick the acrylic was on that on the right side of it, but and the big thing was just like I said, I mean, honestly, this case was really taught me just on managing expectations of the patients. It was pretty straightforward because we were doing a removable prosthetic, but it was, there was some unique aspects of it with all his teeth being moved, tilted lingually. I had to engage all his undercuts on the lingual side instead of the buccal, which you traditionally think you would. And yeah, that was it. And then the next slide, you can kind of see what it looked like intraorally. So the patient was really happy with it, and he actually came in for his last post insertion adjustment this past Monday, and he had to come in for a lot of appointments. That was one thing with him, with all that movable tissue underneath that partial denture. It was causing him a lot of issues, and you could tell his occlusion is not ideal at all. So there was crossbite, and there was a lot of things going on there where I had to do a lot of adjustments to the partial. And but overall, I like the results, and thankfully the patient really liked the results too. I mean, obviously, when you get into pros and you become a practitioner outside of dental school, you're gonna be nitpicking a lot. I wish the teeth slightly match a little bit better, but thankfully the teeth on the prosthetic are lighter than his actual teeth, so that's something he can fix with whitening treatment. And honestly, until I pointed it out, sometimes it's better not to point it out to the patients so they don't real
Yeah.
notice it, because I think I pointed it out. He's like, oh yeah, it is a little bit lighter, because he did not notice, and I think Dr. Thompson didn't notice until I told him to, and he's like, oh yeah, I didn't notice that. So sometimes you can be sometimes what is like the enemy of good is perfect. So sometimes that can happen a lot in dentistry. So that's something to be mindful of. Yeah, that was just one of my first cases. So. Then the next one would be Dr.
And then, yeah, so
McCool's.
this is one of my cases. It's not perfect. There's a lot of stuff that I would do differently, but this was a pretty typical pros wear case. So my patient is he's only in his 40s, but he has severe wear on all of his dentition, maxilla, and mandible. And this was partially due to his bruxing, but it's also partially due to erosion because he is a big user of chewing tobacco. So once we got that habit under control and he quit smoking, quit using chewing tobacco, I did prepare all of his teeth, maxilla and mandible. Thankfully, everything was restorable, and I provisionalized him same day using a full mouth wax up that I had done and temps that were based off of that wax up. So you can see that we did increase his VDO. I did test this out ahead of time using a removable appliance. So we normally give patients a night guard essentially that they wear all day for about 6 weeks, and that tests whether or not they're able to adjust to an increased vertical dimension. And once we figured out that he would be okay with that, we went ahead and did the treatment, and he was super happy because this was like right before Valentine's Day. So he was like, I can show my wife my brand new teeth. So so that's just the first set of temps. Generally, we do multiple iterations of temps in pros, and that's because the first time that you're prepping the patient's teeth, you're trying to get everything done relatively quickly, trying to make sure that you have, good enough preps that everything is restorable. You may be doing core buildups. And so this was the first iteration of temps, but we generally bring patients back multiple times and check the temps and make sure that they're perfect before we get the final impressions, because we want to use them as a guide for fabricating the final crowns. So we'll definitely perfect those over time. And now that we're getting to do more digital, I'm really hoping that for this case, I'll be able to potentially mill some PMMA shells that I would use as temps for him. And then the next case is an all-X case. I got really lucky. I was able to do this with my roommate in Perio. So she placed these implants, but we placed these all on 4 style, which basically means that the posterior implants for this patient were angled so that we would avoid the maxillary sinus. And that's because his sinus was pretty pneumatized and he was going to need bilateral sinus grafts if we wanted to, place any implants further back. So we angled the implants in the posterior, and then I took some pictures while I did the conversion. And a conversion is essentially when you take the patient's denture prosthetic and you poke holes in it, and then you attach it to the implants to some temporary abutments that are placed on the implants. And you pick it up with acrylic, and then at the end, on the bottom right, you can see where I marked in Sharpie, you cut all of that off and you polish it, and then you screw it into the patient's implants, and that's the prosthetic that they go home with. And they're able to clean underneath it because there is a small space, but no one is able to see the space. You plan the prosthetic so that it is completely hidden in the patient's lip. And it's really nice because they don't ever have to remove it. It's as close to their, natural teeth as they can get. And there's no palate, which was very important for this patient. He didn't want the roof of his mouth covered. And so you can see here that the implants, they don't go super far back, and that's because this patient on the mandible actually has his natural dentition, and he only has up to about a second premolar on the mandible. He's missing a lot of his posterior teeth, and this is called a shortened dental arch. So most patients, there are studies that show that they are perfectly okay with second premolar occlusion. And for this patient, he was perfectly fine with that. The most important thing to him was that he wanted to avoid a sinus lift. So we were able to do that. And unfortunately, the pictures of the final prosthetic are on my co-resident's camera because she was helping me take photos. But on the next slide, I just have a picture of what a fixed complete looks like. And that's what we're planning for this patient. That's what his final prosthetic would look like. It doesn't come out and it doesn't have any sort of palate, and it's made of zirconia. So very nice option for most patients. So yeah, and that's it.
That's it.
So do you guys have any questions for us? We said concerns.
Hopefully
I think
don't,
it's more
hopefully
like
don't
comments.
hopefully don't.
So I just want to say This was phenomenal. You guys did a great job. I'm a prosthetic geek, so like I loved everything. Like for a long time, I was considering even doing oral maxillofacial prosthodontics.
Oh, cool.
The only reason I didn't pursue it is just because of time and loans and stuff. So I was like,
That's
maybe in
Sure.
the
yeah.
future if I'm still feeling it. But I've done like Spear and I'm like looking to take
Yeah,
like
Yeah,
Dawson and
it's
stuff.
great.
those are great. Yeah.
Yeah.
Yeah. So I mean, I don't know. I'm curious to see like your thoughts. Like, what have you guys heard about like all these like really good like high end CE for like prosto? Like, you have your Spear, you have your Panky, you have your Kois. Like, what have you guys heard? I know being a prostodontist is a whole different level, but like being a GP and taking these courses, what have you guys heard and like what have
The
your
fact that
docs
we want
told
to
you?
do those courses
We
afterwards.
actually also want to do those courses. Yeah.
Yeah.
They're great courses.
Yeah.
And the biggest thing is that, like I mentioned a little bit earlier in the presentation, but there are so many different philosophies out there.
Yeah.
So
Hmm.
even though we're in pros residency and we're trying to learn all of these different things, we still have a specific philosophy at the school. And for us,
Yeah.
we want to get out there and learn as much as we can. So yeah, Spear, Kois, I've heard really good things about. Dawson, I've heard is really good. Pinky Man, I think also has a
Yeah.
good course. But we're also interested in doing these because the learning really never ends.
Yeah.
Now, I
Correct.
think the biggest thing is just knowing what your personal limits are and what you're
Hmm.
comfortable with. So definitely do all these courses, but if you ever feel like maybe you don't understand something, maybe reach out to your prosthodontist. I do have classmates who have asked me for help before, and I don't mind giving the help at all. Or, refer whenever you don't feel comfortable. But definitely, I think those courses are great.
Yep.
Mhm.
Fair enough. Yeah. I feel like when you leave dental school, a lot of people don't know what's out there, and I think people just take those weekend courses. But like you guys said, like the learning never stops, and it's an investment in you. And like the more you're comfortable doing, the better. And you know, the most important thing is you don't harm a patient, and you do your best. And if you can't do it, you send it out. I mean, there aren't many prosthodontists in my area. There's three, and two of them are 60 plus,
Yeah.
and the other one's like
Where are
49 or
you? Maybe
50.
we should move there.
I'm in Pennsylvania. It's actually a really
Oh,
growing area, but what's it called? There's like I think there's one that's fee for service. Actually, no, they're all fee for service. I'm pretty sure,
most
but they're all
process
basically
fee for
Yeah.
service,
Even
I
our
think.
clinics like essentially feel for service too.
fee
Yeah.
for
Like
service.
dental
It
school.
doesn't
Yeah.
cover a lot of our procedures.
Uh-uh.
Like the amount of crowns that you're doing, for example, for full mouth rehab, I mean, insurance will maybe cover like one or two,
Yeah.
so it's
Especially
just,
even in a residency setting, yeah, I
yeah,
feel like if you're just doing at least at our school with fees, a full mouth rehab without having to do anything else, just the crowns is like 20 grand.
20K,
Yeah.
yeah,
And
Ooh,
yeah,
yeah.
and that's not including, if you're planning
Implants
implants or anything like that.
yeah,
correct.
Yeah, so that's why like trying I mean, I know like in our program, which I think is helpful because not a lot of pros programs do that because there's a lot of work that goes into working up a case. So we screen our patients and then we before they come in for a comprehensive exam, we ask them to pay 50% of the tentative treatment plan they present at the screening. Because we want to see financial investment before we
yeah,
spend
we
all
want to
this
see the
time
commitment.
doing wax ups and consults and dual scans and all of that stuff. So yeah, so I think that's why we're fee for service for
Yeah.
sure. Yeah.
Makes sense.
Yeah.
Um, have you guys also heard of the Resnick, like the Mish Resnick Institute for implants?
No, I don't think I
No.
have. No.
Okay, so that's also really good. Randy Resnick, Randy Resnick, he's a prosthodontist as well. He teaches, and his son Christopher also teaches. I just did my fellowship there for implantology there, so I'm curious, like if you guys have heard of them, but I guess not. But Carl Mish was like the big prosthodontist guy that like,
Oh, awesome. Yeah, that's
yeah,
super cool. Yeah,
he
no,
passed away
yeah, but that's
unfortunately,
really,
but
really cool. Yeah, yeah.
he's good.
Yeah,
But I
we're
think this,
familiar with.
you guys are familiar with it?
Yeah, well, Misha came up with the FP1, FP2, FP3.
Correct.
That
Yeah.
was his
Yeah.
that's his thing. So yeah,
That's his thing.
we read a lot of his papers. Yeah.
His papers are phenomenal. Like I have all the papers and like textbooks like looking at me right now because I just finished.
Yeah.
Awesome.
And I mean Resnick was his partner, is his partner, I guess.
Okay.
Oh,
Oh,
okay.
cool.
So
Yeah, yeah.
phenomenal course.
Yeah.
But yeah, does someone else have any questions? I could talk about pros all day. That's not a problem. Yeah.
Hi. My
Hey,
name's Ikra. How are you guys?
good.
Good, how are you?
Not bad. I was at the nail salon, so I couldn't really chime in earlier.
Hi. You do you, girl.
Yeah, yeah.
So, I guess I guess my question is kind of more selfish because it's pertaining to me.
Yeah.
That's okay.
Um, so I guess I was kind of wondering if I should, because there's a lot that goes into the application, and I'm a
Mhm.
third year student. So technically, I guess I should be applying this year to be able to get in straight from
Yes.
dental school.
Yep.
Yes.
It's a bit intimidating to apply, honestly, and I don't really feel like I have a lot to show for it. Like I don't have a lot of cases. I've been in clinic for a little while, but I don't really have like
You
Yeah.
don't need
You
anything
don't need
crazy to
cases.
case.
show.
I
You
know
don't need to show
I
anything.
yeah, I know I talked about a portfolio.
Okay.
That's just because I happen to have one case during
Mm,
third year, which was I that turned out like first it was like good enough for me to show it to someone. I remember
Yeah.
my third year of
right,
dental
right,
school.
right.
I got like I think I got all my process experience fourth year of dental school while I was on my application cycle. And it was just how my pay because like I feel like in dental school, your
Honestly,
patient,
the process
yeah,
experience in dental school is
yeah.
nothing compared to what you're gonna get in residency. So it really
Oh,
does
It
wow.
not
really doesn't
matter. Like
matter.
it doesn't
Yeah.
matter. Just do your requirements. That's it. Because
Yeah,
in residency, you're gonna end up doing like you're gonna prep more crowns and a full mouth rehab than you probably did all of dental school.
exactly.
And you'll learn it in residency. So it's just an option. For me, I had a case to show because
Mm,
we do like a senior comprehensive care case
Yeah.
presentation, and that's what I showed. But you don't have to do any of that.
Yeah. And like I
okay.
don't think the three prospects that are coming up this upcoming year, like none of them had portfolios or
Yeah,
nothing. They were
no.
just we
Well,
just
one
want to
guy
see.
bragged about how many digital dentures he did.
Shaz, okay.
But
But yeah, I think the big thing is we want to see people who are passionate
yeah,
about pros. Like
Oh, okay.
and that's why I think it's really important. Like so when I was interested in pros, my faculty, the first thing they told me when I went up to them, I had a meeting with them, and they're like, Joel, have you shadowed yet? I was like,
yeah,
no. And he was like, Joel, I don't want you to shadow a private practice prosthetist because they're living the good life now. He was like, go to residency. I want you to see how tough it is to be in pros residency, then come back to me and let me know if you still want to residency. Because like it's a pros residency. I think you in the school right now, it's like the oral surgeons are in the hospital doing their stuff, and then it's us here working on cases.
we're the
Usually
only ones here after
everyone
hours.
at 5 o'clock are out of here, which is like
Yeah,
awesome
Right.
for them. Not that's great, but like for us, it's a lot more work. So like honestly,
Yeah.
if your school has a residency program, do it. Just go
yeah,
shadow.
just shadow.
My dental school didn't. Like East Carolina University, we just have GPR, AGD, and PEDS. So when I got interested in pros, I went to UNC, which is like 2 hours away. I'm from Chapel Hill, so made it easy. I just went back home and I did an externship there. So
Oh, okay.
yeah, so we just want to see people who are passionate about pros.
Yeah,
We don't care like, oh, how many dentures did you do, this, then the
no,
other, how many crowns,
no,
like,
not at all.
don't worry about
They
it.
might ask you, like I did get asked what
Yeah,
my requirement was
I think-
for school,
Mm,
by
hmm.
multiple programs.
yeah. So I think
But
have a. I
they
think
just wanted to know what your requirement
yeah,
was.
that's
That
what it
was
is.
it.
Yeah, just let them know what
Okay.
the requirements
Well,
are.
well, I guess I go to UNLV. I'll just
Oh
there's
yeah,
not many
one of
people
our
here, so
past residents went to UNLV.
Yeah,
oh, really? Okay.
Yeah.
So our requirements are like one full conventional denture case and like two arches of partials. Like six
Yeah.
crowns. Not that much. Not that much at all.
How many crowns?
Six.
Okay. Yeah, just
it's fine.
it's fine. Just tell people if they
Yeah.
ask you, tell them your requirement and be honest.
Yeah, just be.
That's it.
It's just yeah.
Yeah, yeah. Well,
Yeah.
my goal is not to do the requirement. I want to do as much as possible.
Yeah,
I'm
for
paying a
Yeah.
lot of money to be here, and it's been it's been a definitely a long struggle to get here.
yeah,
And I don't want to let it just kind of fly by. I really want to take opportunity. And actually, when I first went into dental school, I had no intention of specializing.
Mm.
I did not want to specialize. I already did like master's program. I already kind of had to go through a kind of a tumultuous road to get to dental school. So I was like, I'm kind of done, and I'm just gonna be a general dentist. And then when I actually started getting more into general dentistry, and plus I also come from a first generational family, so I have zero background in any sort of medical or dental. So really I'm coming in kind of like blind.
Yeah.
And then once I started actually getting into general dentistry, I realized what I envisioned for myself was not bread and butter dentistry. It was more
Yeah.
so full mouth
I didn't want to
reconstruction.
do those class twos. I was like, nah,
Hey,
I
that's
mean,
fast
I
food,
admire, I
fast food
totally
have a
admire and I respect general dentistry, and I mean that's the reason why I was even interested in in the first place, because I wasn't ready. I didn't want to specialize in pigeon myself into like a small area. I love operative dentistry.
yeah.
So
DMV plus two takes a lot of skill.
yeah.
Can't put it
yeah,
on.
so
Yeah.
like this was kind of like if I don't do this, I'm not going to be happy. I'm not going to be happy with
And I
where
think
I'm at, and
I
I'm not
couldn't.
going to.
Yeah, and I
Yeah.
can relate with you. I think I was having that mindset. I came with
Yeah,
a specialty mindset, like I said, but there was a point in dental school where I was like, I just want to start working, and then
for sure.
I started shadowing pros, and I was like really starting to love it, and I was like, let me just I'd
Yeah.
rather do this now than like wait 10 because then like one of my pros faculty he did general dentistry for 10 years, and then he went back to pros residency, and he was like, Joel, if you have the inkling to do it now, just do it now. I know it's rough
Yeah.
because
Yeah,
and this is one thing in dentistry, which is so much harder than in medicine, because in medicine, everyone goes to residency. In dentistry, your friends, your classmates are gonna start living that good life right after graduation, and you're gonna be a resident
sure.
living student life for another 3 years. But I mean, if you
Well,
know
I'm a
this,
little crazy because I tend to be more jealous of the ones that are. So the thing is, I kind of look at what other people are doing, and this is kind of a bad habit. I tend to compare myself. I think you can attribute that to my brown parents.
we're all brown.
That kind of habit.
I can relate.
But I kind of I'm like, I'm not looking at the people that are like already living it up. I'm kind of jealous of the ones that are trying to do more,
Heck yeah.
and I feel like I can do more. I'm capable of more, but I'm kind of holding myself back. So
Yeah.
I definitely want to take that chance instead of holding myself back.
That was my mentality. I was like, it's 3 more years for me to be able to do the type of treatments I want to do,
Yeah.
like that was envisioning
Yeah.
myself to do as a provider, then so be it,
Yeah.
So it can be like mentally, sometimes it can be rough, like personally for me, but then I'm seeing the cases I'm doing and the like really interesting cases I'm doing every day. And it just, I mean, I'm thankful to be in the position I'm
Yeah.
in. So
I don't think there's
Yeah.
any harm in trying to apply. I would
Sure.
definitely apply if you want to and just see, how things work out for
yeah.
you. Like we said, cases not that important.
Yeah, I was
Shadowing,
about that.
100% do that if you can. Just put everything that you can on the application, and then if anyone asks you anything, just to be honest. And if you've done
Okay.
more than your requirement, then mention that, and then, you've done everything that you
Yeah.
can, and I definitely think it's worth a shot.
Yeah.
Like I don't think I wouldn't worry about like, oh, I haven't done like this, so I can't apply to pros residency. Not at all. It's definitely still 100%
Also,
worth applying.
personally for me, I only started working my application like in the summer. I was like, it was like a Hail Mary to get everything. I got everything done like August 1st. So
Don't be like
Oh,
Joel.
okay. I mean,
but if
see,
you're like me,
so
it can still
I'm
work
kind
You
of
out.
had
like,
everything ready in April.
I didn't, and I had my letters of rec already kind of lined out, but like the actual application, left for the summer. I wish I didn't. If I could do it again,
yeah,
I would do it earlier. But if you're in that case, like you can do it.
Yeah,
Like
you can still do it.
you
A
for
can,
lot of the
sure.
it's
interviews
just
are
really
rolling.
annoying. Yeah, that too.
So they'll have multiple interview dates
Yeah.
too. So if you get your application in a little bit later, like they'll give you a later date.
Yeah.
It's not that.
Just be mindful because all the programs have different application deadlines.
Yeah.
It's not all one date. So just make I
Right,
made
right,
a
right.
Excel sheet
Yeah,
for the
make an
list of
Excel sheet.
programs, and I made sure like, okay, this program I need to submit it by this day and this day and whatever. So
Yeah.
yeah.
But yeah,
Yeah.
good luck with
You got
everything.
this.
Let us
Okay.
know if you want to come.
Thank you.
Yeah. Yeah. Do come do an externship at DCG. We have people.
Kind of far, but
It's
still.
kind of far, but we had a student from New England come visit and
Yeah,
stuff. And
he
So
very
I mean, externship, because the thing is, I thought it's kind of like an official thing, but is it something that you just kind of talk to any school and be like, can I just come here
reach
and
out to the
Yeah.
see
program
what's
director
going
to see
on?
what the protocol is. Just reach
Yeah,
out.
just reach out to the program directors or
Yeah.
the schools and say, hey, this is what I'm
Okay.
interested in doing.
Here DCG is only like a day, I think.
Yeah, I think here you can
Um,
only shadow for a day
Yeah,
max.
but like I went to UNC and
S-
I was there for like a week and I got to like just go
So,
and stuff like that.
okay, so from here, I don't have that much time in terms of application, and I basically decided I want to do pros over the winter break. So that's kind of why I'm like so short in time. But
That's
I also don't have research, and I don't have really high GPA either. And I don't have leadership experience. So I'm lacking in a lot of areas. However,
So
I'm working on I have shadowing and volunteering, so that's one thing I have.
yeah,
Volunteering is
Thankfully.
also leadership.
yeah, that is. And I
Oh,
would say
okay.
regardless of where you are, just apply. And then worst case, like I said, you either do post match, and if you really want to do pros, you're gonna do an AGD, do a GPR, go into private practice, and then reapply.
Yeah.
Okay, it's not the end of the
Okay,
world if you get in right after dental school. You're
for
still
sure.
gonna pay tennis, which is a great
Yeah.
position to be in. So,
Absolutely.
yeah,
Yeah.
Yeah. Just, try to put everything that you can, like anything that you can think of on the application.
Yeah.
It's not like, oh, I haven't done research or whatever. You mentioned you do volunteering.
Yeah.
Mention all the volunteering. That's great
Of
stuff
course.
to have.
I mean,
And like
I
anything
actually like,
involved
do you
with.
think it's too late to kind of add things? Because I'm trying to do research like next month, you know,
time,
like trying to
but
start
Always
things.
mention in your interview that you've done something
yeah,
extra.
that's
So
true.
for
That's
example,
true.
you apply and then you get an interview and they ask you like, hey, you don't have any research experience. You can say, oh, actually, when I was applying, I did it, but
Yeah.
it's many months later and actually I am
Mhm.
currently doing research like that.
Yeah.
You can do that. That's not a problem at all.
Okay, sure,
Yeah.
sure. Okay,
So
it's just very daunting that this is like the same process that we did to get into dental school, and having to do it again. I'm like,
It
it's a bit overwhelming if I'm gonna be
yeah.
honest, because I wasn't really planning on doing this. So, but now that I am, it is a bit overwhelming. But I did
Well,
it once, I could do it again. So
yeah, and we wish you the best. And you have on the Instagram, you have our our
DM us if you need
yeah,
any help.
DM us if you have any questions or anything.
Yeah.
Okay?
Like
Oh,
literally
okay.
anything. We'll read your essays, anything you want.
Yeah,
Yeah.
for sure.
Oh, that'd be amazing. I mean,
Yeah.
prosthodontics is a very small world, so I would appreciate any sort of guidance
Yeah,
Yeah,
your world
yeah,
is a lot
all.
yeah.
smaller. Like everyone knows each other. It's
Yeah.
kind of nice to have a small, tight knit
And even if
community.
you can't come here or don't apply here, we hope we can see you at like a meeting or something.
Yeah.
That would be really nice.
Yeah.
So yeah.
Georgia's on my list because the
Yay!
stipend
We have
thing,
a
and
stipend.
We have a stipend.
yeah, I mean, to me that's
Yes.
important.
University of Tennessee also has a stipend.
Yeah,
I
Tennessee
think
has a
Mayo.
stipend. UCSF has a stipend, but I'm telling you now, it's too low for living in San Francisco, but it's something.
Oh my God, San Francisco. So, well, actually my husband, he's also in dental school with me right now, and he's in the same class as me, so he will be a dentist. Fingers
Well, that's
Nice.
crossed.
nice.
So
Yeah.
I'm hoping that there will be some kind of help
Yeah, that's
there.
support. That's
I mean,
support
obviously it will
helpful.
be.
Big. Yeah, that's huge.
Yeah.
Yeah,
But
but no, I made
yeah.
a list of all the schools that do offer a stipend and have a low tuition. I think I made it's like 15, 16 schools, and they
Yeah.
include the
Yeah,
VA
it's not
programs too. But I would prefer to
Yeah,
have a
VA programs are
co-resident. I
good.
don't want to be alone.
Yeah. Yeah,
But yeah,
some of the residencies, some accept more, some accept less. So I think like UAB was a pretty big program, and then Tennessee accepts only 2 per year. And I was a little worried that if I hated the other person, I'd be miserable. So we do 3 per year. So if
yeah,
you hate one other person,
okay.
it's okay because then you can gang up on them with the other. But no.
Right. You have
No,
higher
no,
chance
But
of
yeah, just
success. Yeah.
that is a good thing to keep in mind too. Like you mentioned, you don't want to be the only one. So yeah, just look and see how many they accept per year.
Yeah.
But yeah, definitely
Well,
DM us if you need any help at all.
Mhm.
No issue.
well, I sincerely appreciate that. Sorry if I cut you off.
No,
I'm just trying to like
great.
tell you whatever. And
No.
also I appreciate you guys doing this because there's not a lot of information about prosthodontics at all. And even trying to like figure out what my school list is, it's very difficult because there's not much information, and I don't really
Try
necessarily
that
want to
link.
rely on anecdotes, from
Yeah,
the internet.
try
So
that link that I sent. That lets you. Well, you already have a list of programs though, and then
yeah,
honestly,
I'm
the
a
best.
research gal. I love to do my research.
Perfect.
So
Yeah,
I've scoured the internet, literally scoured the internet, anything pros related. That's how I ended up finding this like Instagram. I'm like, oh,
that's
brown,
awesome.
like I need to be part of a community. I feel pretty isolated, if I'm gonna be honest. So being able to be part of like around brown people who are also dentists, that's pretty cool.
Yeah.
Ooh, DC Dennis. Yeah.
Woo! So yeah, I
Yeah,
appreciate
no,
that.
that's awesome. Yeah. And definitely just talk to residents too. Talk to the other
Sure.
residents, just reach out to them whenever you can.
Yeah.
I learned a
Yeah.
lot from the other residents because you're right, there really isn't that much out there. So
Yeah.
I asked them all sorts of stuff. Like I asked them, is it safe to live here? Like I asked them like
Oh,
anything
okay.
you can think of, you can ask the
Sure.
residents, they'll be very honest with you. So yeah. But yeah, good luck
Okay,
with
cool.
everything.
Everything.
I sincerely appreciate that. Thank you.
Yeah, and we appreciate you coming and listening to us talk.
Yeah,
And
of
I just want
course.
to say, Ikra, it's really nice to hear. Nadia's on mute, but we were just talking about it. Like you saying that, we wanted to join like a brown community. It's literally the reason Nadia started all this, and I joined her
Yeah.
as
Mm.
one of the board. Is like, man, we don't have a big brown community in dentistry, and I think like medicine kind of has it, but it's kind of scattered. But like, she felt really passionate about this, and when I met her a couple years ago, I was like, this is a project I really want to be a part of, and it's like we've met so many great
Yeah.
people, and just helping each other out is fantastic. And no matter what pathway we go down, I think that's like the most important things. We help each other up. We work together to really build a solid community, so we have that network, because there
Yeah.
is a lot of information out there, but it's just very scatterbrained. It's not very organized, and that's kind of what Nadia's and I, like, our hope is to kind of bring that to the forefront of dentistry. So yeah, thank
Yeah.
you for joining us. And Joel and
I appreciate it.
Doc, like, we really appreciate you guys taking the time to talk about prosthodontics. I mean, I love prosto, so it's like, for me, it's very near and dear to my heart.
Yeah.
And you guys just did a phenomenal job. So I want to say thank you so much for taking time out of your day. And thank you for the people that will listen to this. It was a fantastic event. And I just want to ask you guys, if you guys would like, Joel and Dr. How do you say your last name? I can't say. I don't want to butcher.
Oh, well, the brown way is Ratansi. But it's
Ratansi, okay.
Ratansi's okay too. Yeah.
Um,
Ratansi.
That's
but
what it became.
Yeah.
What we-
I understand that struggle.
Yeah.
what we would love is, if you guys want in the future, I would love to see like a full mouth rehab case from start to finish. If you guys want to just lecture, that would be, I think, phenomenal. Like, you go through like the documentation process, and talk about like what you're thinking and treatment planning. I was talking to Nadia. I was like, that would be phenomenal, just to see a case start to finish, and just see
Yeah,
all the
I actually
process.
have the treatment planning presentation that I did for that case that
Yeah.
I presented. So we
Okay.
have to do treatment planning.
Yeah, you do a lot of presentations.
Yeah.
So you get good at public speaking.
Yeah, we have no problem with that at all. And Joel can do one too, like maybe
Yeah,
like one
absolutely.
that started, and then I
Yeah.
have one that's in the temps. We would love to do
That'd be
that.
fun,
Yeah.
yeah.
Just
Yeah,
let us
yeah.
know.
Awesome. All right, we'll make it happen then.
And this is a
All right.
great community that we want to be a part of. So
Yeah, thank
I'm
you
happy
so
we
much
found it,
for
yeah.
starting this and also for having us. We
Yeah,
really
for sure.
appreciate it.
Yeah.
Our pleasure. I
Mhm.
don't think there are any more questions. So Nadia, if you want to stop recording, we should be good.
Sweet. Well,
Yeah,
okay,
cool.
cool.
Yay.
Well, y'all have a
All
good
right.
night.